Hello everyone, I'm Dr. Cook of Signature Smile. Hope you guys are being safe and finding some way to enjoy some of this downtime that we're having. What I want to do this evening is just answer a couple questions that have been posed by some of my patients. So let's take a look. Can you explain the difference between a bridge and dental implants? And what are your thoughts on full top implants? So the biggest difference between a bridge and dental implants is that a bridge is going to involve placing crowns on multiple teeth, while a dental implant, which is a titanium screw, replaces the individual tooth. What are my thoughts on full top implants? Well, under the right circumstances, the full top implants, or what we call a hybrid, I feel is going to provide the best form, function, and aesthetics when compared to a simple denture. Are tongue scrapers necessary, or can I just brush my tongue with my toothbrush? I would say that tongue scrapers are not necessary. You can use your toothbrush to clean your tongue, and it does a very good job. That's what I do. But I know for some people, they have a higher buildup of debris on their tongue, and a tongue scraper may work best for them. It just depends on the scenario. I would give them both a try and just see which one you like best. How do you treat sleep apnea? I hate my CPAP. Why is it important that I treat my sleep apnea? So how do I treat sleep apnea? Oh, what I use is called a mandibular advancement device. And what it does, it brings the lower jaw forward. And by bringing the lower jaw forward, it brings the tongue forward, thus opening the airway in the back. You hate your sleep apnea, you hate your CPAP, you're not alone. Why is it important that you treat your sleep apnea? Because if you think what sleep apnea is, it's basically creating multiple hypoxic events throughout the night. And what happens when the brain and the heart undergo multiple hypoxic events, you get death of tissue. And unfortunately, death of tissue leads to death of the person, which we do not want. That's why it's very important that you treat your sleep apnea. But that's on the extreme end. There are other things that are associated with sleep apnea, such as obesity, cardiovascular disease. In men, there's been a correlation between sleep apnea and impotence. And women, there's decreased libido. So there are multiple things that are associated with sleep apnea, not just death, but like I said, that's the ultimate. So we do want to get that treated. My spouse snoring keeps me awake at night. Would an appliance help him? So if your spouse snores so bad that it keeps you awake at night, there is a possibility that he has sleep apnea. So the first thing that I would do is recommend that he get tested for sleep apnea. And if it comes back that he does have sleep apnea, maybe he needs a CPAP or a mandibular advancement device. But I will tell you there that we have other means of treating snoring alone. A mandibular advancement device would help, but we can also use lasers to treat sleep apnea now, so that's an option for him as well. And this last question is, what does the sleep appliance look like? What it looks like is basically, looks very similar to a bleaching tray or fluoride trays, one on top and one on the lower arch, and they're connected together. And like I said, it can be very thin pieces of plastic to a very robust appliance. There are multiple styles of mandibular advancement devices. And what we would need to do is just see what works best for you. Does it go over my face or inside my mouth? So when you're speaking of appliances that go over the face, that's typically a CPAP. The mandibular advancement device is going to fit over the upper and lower arch. And let's see, we may have time for one more. Let's see here. How is oral health related to heart health? Well, the bacteria that cause inflammation of the gums that we find in the mouth are also the same bacteria that we find in the heart. What happens is once those blood vessels in the mouth, the gum tissue becomes inflamed, those bacteria are able to enter into the bloodstream and then find their way to the heart. Once they get to the heart, they cling to the valves in the heart and could cause coronary artery disease. And typically we see this in our patients that have periodontal disease. So that's why it's very important that you keep your oral cavity very clean. I want to thank you guys for submitting these questions. And what we're going to do, we're going to return and answer some more questions. So I do want you guys to stay tuned and keep sending in those questions. Enjoy your day. Take care.